Davis. I'm an assistant professor of curriculum and instruction at Montana State University, and we're here today to talk about a recent study that I just finished up in a neighboring county with anxiety and high school students and a trauma-informed yoga intervention. And the more I learn about the community, the more I realize it has the highest suicide rate in the state, and that Montana has the highest suicide rate in the country. And I thought, well, gee, this seems kind of serendipitous that I'm ending up here and that this is kind of what I want to do. So started having some conversations with the school district, and we came up with a mutual idea of some instrumentation that they wanted to use with their high school kids. And so it was really a collaborative effort of us figuring out how we can best support the high school students in Park County while also simultaneously giving us some data to work with. And so this past spring, we did our initial larger pilot study where we incorporated trauma-informed yoga into a strength training class. And you can imagine that the high schoolers were pretty, we'll say, unexcited about doing yoga in what they were hoping would be a weight training class. And they did weight training, but twice a week they did trauma-informed yoga with certified yoga teachers. And you know, despite the initial hesitation and frustration and reluctance, we started noticing a change in the students where they started engaging more with the teacher, they started engaging more with each other. They were writing comments in their notebooks like, I came in here really stressed out because I just had an AP calculus test and I'm suddenly feeling like I can make it through the rest of the day. And so even just those qualitative comments were reason enough that we were like, okay, we need to keep looking for future funding and keep this going. We are still analyzing some of the data, but overall the findings have been tremendously successful. There were statistically significant decreases between pre and post intervention on the generalized anxiety disorder scale with the students, as well as significantly decreased levels of depression as measured by the Patient Health Questionnaire for Adolescents. And there was also a very significant reduction in student cortisol levels from the pre-intervention to mid-intervention. We were really hoping to get post-intervention cortisol, and sadly / also ironically, the last week of our study, COVID closed the schools, so we were not able to finish it, which was really a bummer. And I was worried that we wouldn't be able to get student post surveys. But I think the fact that we had a huge response rate from the students was indicative of the fact that they wanted to tell us that this helped and it worked.
Hi, I'm Aylward. I'm an assistant professor in the Department of Education, and I have the privilege of working with Dr. Davis on this research study. Specifically, I'm helping with evaluating the efficacy of this trauma-informed yoga intervention. Once we started talking, I got really excited and realized it was a great contender for a more sophisticated quasi-experimental method called propensity score matching. And the reason it's such a great contender for this is because the data the study was already underway, and more importantly, it's hard to do a randomized controlled trial in education, right? It's often not ethical. So how do we evaluate the efficacy of a treatment when we can't have a randomized controlled trial? And there's a quasi-experimental method called propensity score matching. And post hoc, so post-intervention, we can create a matched comparison group. So looking at a range of attributes like gender and GPA, attendance rate, and we find a control group. And that control group becomes a counterfactual for the treatment group. So what would have happened to the students that participate in the yoga treatment in the absence of actually participating? And then we can actually say something about the efficacy of the treatment rather than just there's a relationship between participating in yoga and student outcomes. So it's just a stronger finding, and you're able to have more certainty about the results that this yoga intervention actually helps students in reducing anxiety, reducing stress, and improving academic outcomes.
And so we have a plan this year of doing a larger study with a control group, and we are planning on incorporating, hopefully, face-to-face yoga classes as well as some Zoom yoga classes, and then we're going to be able to look at the differences on what student preferences are and see if there's any difference in the data between face-to-face yoga and virtually delivered yoga. But one thing that I'm really excited about that we're adding to the data set this year is we were able to incorporate an incentive of giving all of the kids Fitbit Inspire HRs to participate either in the experimental group or the control group. And so that way we're going to be able to take a look at their resting heart rate, see if that changes, look at their sleep cycles and see if their sleep improves. So I'm really excited about increasing the number of dimensions, I guess, that we'll be assessing in this second iteration.